What if I told you there's a completely free, medication-free way to reduce your prostate cancer risk by 21%, improve your sleep, and lower your blood pressure, and you can do it in the privacy of your own home? Today we're having an honest, medical conversation about sexual self-care after 50, and its surprising health benefits that your doctor might be too uncomfortable to discuss. Most people our age were raised to believe this topic is taboo, shameful, or even harmful to your health. The real reason doctors don't discuss this has nothing to do with health risks and everything to do with outdated cultural discomfort. What medical schools don't teach about this subject could fill a book. Yet the research is clear and compelling. By the end of this video, you'll understand exactly how this natural activity protects your prostate, why it's better than sleeping pills for many people, and what frequency is optimal for your age and health status. As a urologist with 12 years of experience, I've seen how cultural shame prevents important health conversations. Today, we're going to approach this topic with the medical seriousness it deserves, because the health benefits are too significant to ignore. Let's start with something that affects nearly everyone over 50: sleep problems. If you're among the 70% of older adults struggling with sleep, you've probably tried everything from melatonin to prescription sleeping pills. But here's what pharmaceutical companies don't want you to know. Sexual release, whether with a partner or through self-care, triggers a powerful cascade of natural sleep hormones that no pill can replicate. When you reach climax, your brain releases a cocktail of chemicals, including oxytocin, often called the bonding hormone, and prolactin, which promotes deep relaxation. These aren't just feel-good chemicals, they're powerful sleep inducers. Oxytocin reduces cortisol, your stress hormone, by up to 30%. High cortisol is one of the main reasons people lie awake at night with racing thoughts. Prolactin levels surge to 4 times their normal amount immediately after release, creating that deeply relaxed, sleepy feeling. This is the same hormone that makes you drowsy after a large meal, but in much higher concentrations. The research is compelling. A study of over 1,800 adults found that those who engaged in sexual activity before bed fell asleep an average of 15 minutes faster and reported 25% better sleep quality. Compare that to sleeping pills, which often leave you groggy, can be addictive, and lose effectiveness over time. Another fascinating finding is that this natural sleep aid works better as we age. While younger adults might feel energized after sexual activity, people over 50 consistently report improved sleep, likely because our bodies become more sensitive to the relaxation hormones as we age. Here's how to optimize this for sleep. Timing matters. About 30 to 45 minutes before your desired sleep time works best. This allows time for the hormone cascade to fully develop. The environment should be comfortable and stress-free. If you're dealing with insomnia, this can be part of a healthy sleep hygiene routine. Don't treat it as a quick fix, but as part of overall wellness. And remember, this works whether you're with a partner or on your own. The hormonal response is virtually identical. For those taking sleep medications, this natural approach might help you reduce or eliminate pills, but always consult your doctor before changing medications. I've had patients successfully transition from Ambien to this natural method, reporting better morning alertness and no more midnight confusion or sleep eating episodes. One patient, Michael, had been on sleeping pills for 5 years. We developed a plan where he gradually reduced his medication while incorporating regular sexual wellness. Within 3 months, he was sleeping pill-free for the first time in years, and his wife noticed he was more alert and engaged during the day. While better sleep is wonderful, there's an even more important benefit for men that could literally save your life. The Harvard School of Public Health conducted one of the largest studies ever on this topic, following 32,000 men for 18 years. What they discovered should be headline news. Yet most men have never heard about it. Men who ejaculated 21 or more times per month had a 21% lower risk of developing prostate cancer compared to those who ejaculated 4 to 7 times monthly. Let me put that in perspective. That's better protection than many expensive supplements or medications provide, and it's completely free with no side effects. But why would this natural activity protect against cancer? The mechanism is fascinating and makes perfect biological sense. Your prostate is constantly producing fluid that becomes part of semen. When this fluid sits in the prostate for extended periods, it can accumulate potential carcinogens and inflammatory compounds. Think of it like changing the oil in your car. Regular circulation prevents buildup of harmful substances. Additionally, regular ejaculation may help flush out crystallized minerals that can cause inflammation and potentially lead to cancerous changes. The research gets even more specific for our age group. The protective effect is strongest for men over 50, exactly when prostate cancer risk increases. Men in their 50s who maintained regular sexual activity showed a 33% reduction in aggressive prostate cancer, the type that's most dangerous. This isn't about excessive frequency. The study found that the benefit plateaus around 21 times monthly, which averages to about 5 times per week. More than that doesn't provide additional protection. For men who've already had prostate issues, this is still relevant. Unless your urologist has specifically advised against it, regular ejaculation can help manage benign prostatic hyperplasia or enlarged prostate symptoms. It reduces congestion and may improve urinary flow. I tell my patients to think of their prostate like any other part of the body. Regular, appropriate use maintains health. Now, some men worry about depleting their testosterone or energy through frequent ejaculation. This is a complete myth. In fact, studies show that regular sexual activity actually maintains healthy testosterone levels in older men. One study found that men over 60 who maintained regular sexual activity had testosterone levels 15% higher than those who didn't. Your body is designed for this. It's not depleting you, it's maintaining vital systems. For those dealing with prostate cancer treatment, always follow your oncologist's guidance. But for prevention, this is one of the most powerful tools we have. I've seen too many men develop prostate problems who could have potentially prevented them with this simple, natural approach. One patient told me he wished someone had explained this 20 years ago instead of just telling him vague warnings about prostate health. I'm curious about something. Has your doctor ever discussed these health benefits with you? Type 1 for yes, 2 for no. Your responses help me understand what information is missing in healthcare conversations. This protection extends beyond cancer prevention to something equally important for quality of life. There's a phrase in medicine, use it or lose it. This applies perfectly to sexual function as we age. Regular sexual activity, including self-care, is like exercise for your sexual health system. It maintains blood vessel flexibility, nerve sensitivity, and hormonal balance. Without regular activity, these systems can atrophy, leading to erectile dysfunction in men and arousal difficulties in women. The vascular component is crucial. An erection requires healthy blood flow, and regular erections actually exercise the blood vessels in the penis, keeping them flexible and responsive. Think of it like stretching exercises for your arteries. Studies show that men who maintain regular sexual activity are 40% less likely to develop erectile dysfunction compared to those who don't. This isn't just about maintaining function for pleasure. It's about maintaining a vital sign of cardiovascular health. Erectile function is often called the canary in the coal mine for heart disease because the penile arteries are smaller than heart arteries and show problems first. For women, regular sexual activity maintains vaginal health, especially after menopause. It promotes blood flow to vaginal tissues, maintains elasticity, and can help prevent the atrophy that leads to painful intercourse. The hormonal stimulation also helps maintain natural lubrication. Women who maintain regular sexual activity report fewer urinary tract infections and better bladder control. The neurological benefits are equally important. Regular sexual activity maintains the nerve pathways between your brain and sexual organs. These neural connections can weaken without use, making arousal and orgasm more difficult over time. It's similar to how practicing a musical instrument maintains those neural pathways. Stop practicing, and you lose the skill. Here's what I recommend for maintaining function. Aim for sexual activity at least once or twice weekly. This can be with a partner or solo. The key is regularity, not intensity. If you're experiencing function issues, don't wait. Address them early when they're easier to reverse. Many men wait years out of embarrassment, making treatment more difficult. Morning is often the best time for men, as testosterone levels are highest. For women, whenever you feel most relaxed and unstressed. If you're single, or your partner has health issues, self-care is perfectly healthy and beneficial. There's no age at which you should stop. I have patients in their 80s and 90s who maintain healthy sexual function. The key is adapting to your body's changes rather than giving up. This might mean using lubricants, trying different positions, or using aids, all of which are completely normal and healthy. This vascular benefit extends to your entire cardiovascular system in ways that might surprise you. Sexual activity is actually a form of mild to moderate cardiovascular exercise. During arousal and orgasm, your heart rate increases to between 90 and 130 beats per minute, similar to climbing stairs or brisk walking. Your blood pressure temporarily rises, then drops below baseline afterward, providing a beneficial cardiovascular workout. Regular sexual activity has been shown to reduce resting blood pressure by an average of 5 to 8 points, comparable to some blood pressure medications. The cardiovascular benefits go beyond the physical exercise component. Sexual activity triggers the release of nitric oxide, the same compound that heart medications like nitroglycerin produce. Nitric oxide dilates blood vessels, improving circulation throughout your body. This is why some people notice their chronic pain improves after sexual activity. Better blood flow means better oxygen delivery to tissues. A fascinating study from Wales followed 914 men for 20 years and found that those with regular sexual activity had half the risk of fatal heart attacks compared to those with low frequency. The protective effect remained even after adjusting for other factors like exercise, smoking, and social class. The researchers concluded that sexual activity might be a marker of overall health, but also provides independent cardiovascular protection. For those with existing heart conditions, let me address the elephant in the room. Is it safe? The actual risk of heart attack during sexual activity is extremely low, about 2 to 3 per 10,000 person years. To put that in perspective, you're more likely to have a cardiac event while getting angry or shoveling snow. If you can climb 2 flights of stairs without chest pain or severe breathlessness, sexual activity is generally safe. However, always consult your cardiologist if you have concerns. The stress reduction component is particularly important for heart health. Chronic stress is a major risk factor for heart disease, and regular sexual activity is one of nature's best stress relievers. It lowers cortisol, reduces inflammatory markers like C-reactive protein, and increases heart rate variability, a marker of cardiovascular health. One study found that people who engaged in sexual activity at least twice weekly had lower stress-related blood pressure spikes during public speaking tests. Quick question about your approach to health. Type 1 if you prefer natural methods when possible, or 2 if you rely primarily on medications. This helps me tailor future content to match your preferences. Now, if you're taking medications, there are important considerations you need to know about. Many common medications can affect sexual function, and understanding these interactions is crucial for maintaining both your health and quality of life. As a urologist, I see patients every day who don't realize their medications might be interfering with sexual health, and simple adjustments can make a huge difference. Blood pressure medications are the most common culprits. Beta blockers like metoprolol or atenolol can reduce sexual function in up to 30% of users. They work by blocking adrenaline, which also blocks some arousal responses. ACE inhibitors like lisinopril are generally better for sexual function. If you're experiencing issues, don't stop your medication, but do talk to your doctor about alternatives. There's usually a blood pressure medication that will work without affecting sexual function. Antidepressants, particularly SSRIs like sertraline or fluoxetine, can significantly impact sexual function. Up to 70% of people on these medications experience some sexual side effects. But here's what many doctors don't tell you. Maintaining regular sexual activity while on these medications can actually help preserve function. It's like physical therapy for your sexual response system. Some patients find that scheduling sexual activity for mornings, when medication levels are lowest, helps considerably. For men on prostate medications, alpha blockers like tamsulosin can cause retrograde ejaculation, where semen goes into the bladder instead of out. This is harmless but can be disconcerting. Finasteride for prostate enlargement or hair loss can reduce libido in about 5% of men. If you're experiencing these effects, discuss alternatives with your urologist. Sometimes adjusting the dose or timing can help. Diabetes medications generally don't directly affect sexual function, but uncontrolled blood sugar certainly does. High blood sugar damages blood vessels and nerves essential for sexual function. If you have diabetes, maintaining good blood sugar control is crucial for preserving sexual health. Regular sexual activity can actually help with blood sugar control, as it's a form of physical exercise. For those on cholesterol medications, statins rarely cause direct sexual problems, despite what you might read online. In fact, by improving blood flow, they often enhance sexual function. However, if statins are causing muscle pain or fatigue, that can indirectly affect your sex life. There are usually alternatives if this is an issue. Here's my key advice about medications. Never stop taking prescribed medications without consulting your doctor. Instead, have an honest conversation about sexual side effects. There are almost always alternatives or adjustments that can help. Many doctors won't ask about sexual function unless you bring it up, so be your own advocate. Keep a diary of when you take medications and when you experience sexual function issues. This information helps your doctor make informed adjustments. We've discovered how this natural activity can improve sleep without pills, reduce prostate cancer risk by 21%, maintain healthy function, support heart health, and work alongside your medications. These aren't minor benefits. They're major health interventions that cost nothing and have no negative side effects when practiced safely. What surprised you most about these medical benefits? I find that most people are amazed that something so natural could be so medically beneficial. As a urologist with over a decade of experience, I believe everyone deserves accurate health information, regardless of cultural taboos, especially when it can prevent serious diseases. Too many of my patients suffer unnecessarily because they were too embarrassed to discuss sexual health or didn't know about these benefits. Remember, this isn't about promoting excessive behavior or replacing medical treatment. It's about understanding that sexual wellness is health wellness. Whether you're single or partnered, whether you choose self-care or intimate connection, these health benefits are available to you. There's no age at which these benefits stop. I have patients in their 90s who maintain healthy sexual function and reap these rewards. If you're dealing with sexual function issues, please don't suffer in silence. See a urologist or sexual health specialist. Modern medicine has many solutions, from medications to devices to therapy. The sooner you address issues, the easier they are to treat. And if your doctor dismisses your concerns because of your age, find another doctor. You deserve quality of life at every age. For those in relationships where one partner has different needs or abilities, communication is essential. There are many ways to maintain intimacy and gain these health benefits that don't require both partners to have the same capabilities. A sex therapist who specializes in older adults can provide valuable guidance. If this information could help someone you care about, please share it with them. You might save them from unnecessary medications, help prevent serious diseases, or simply improve their quality of life. These conversations might feel awkward, but they're important. Hit the like button to help other adults find this vital health information, and subscribe with notifications on for more honest, evidence-based health conversations that your regular doctor might not be having with you. One final thought: your sexual health is a vital sign of overall health. Changes in sexual function often signal other health issues like cardiovascular disease, diabetes, or hormonal imbalances. Don't ignore these signals. They're your body's early warning system, and addressing them early can prevent more serious problems. Check out this next video about the 5 medications that might be sabotaging your sleep. You'll be shocked which common pills are keeping you awake and what natural alternatives might work better. Until next time, remember that taking care of your sexual health is taking care of your total health. Thanks for watching, and see you in the next video.